So on behalf of our regional office in Latin America, I would like to start this roundtable, which was kindly provided by our headquarters in DC. And how is the sound? Is everybody listening to me fine? Yes? Okay.
Perfect.
So maybe a good idea would be to introduce ourselves. My name is Valeria Aoki. I'm an associate professor here in dermatology, and I joined the international office last year, and honored to be part of this team. So the next, maybe the Association Health Center headquarters. Would you like to introduce yourselves?
Hi, everybody. I'm Christine Smith. I'm the Director of Member Programs. I know a lot of you. It's very good to see you and meet a couple of you as well.
Hi, everyone. Welcome. I'm Habiba Osmani, and I'm the Program Coordinator with AAHCI, and good to see some familiar and new faces.
Well, now maybe the regional office, Professor Aller, please.
I am the Professor Aller. I'm the former Dean of Medical School, and right now working in the hospital, taking care of the team that are taking care of the COVID-19 patients. Is a difficult task, but you are going on, I hope. Thanks to see everybody safe and healthy.
You're mute, Valeria.
Yes, Professor Aller is a member of the Association of Academic Health Centers in the steering committee. And now Professor Krieger, where are you?
Professor Krieger, there.
My name is Eduardo Krieger, and I work in the Heart Institute here in the medical school, but I am working as the executive director of the International Relations Office, working with the Dean International Relations, and I'm very satisfied, very proud to be here today and exchange idea and experience with our colleagues from Latin America and Caribbean, and of course, to see our people there in Washington, Abiba and Christine. I believe Christine, we met several times, international meeting. So it's nice to see you again, Christine.
Very good to see you as well.
Now, members are from Monterrey, Mexico.
Thank you. It's a pleasure to be here. I'm Jorge Valdez. I'm a professor of ophthalmology, but also I'm the dean of the medical school of and health science of the Tecnológico Monterrey. And I took the liberty to invite some colleagues. Our university is a multi-campus university, and the School of Medicine has 3 main campuses, are the images that I have in the background. So we have some representatives from Monterrey, where I'm but also we have from Guadalajara. I'm seeing Dr. Vasquez and Dr. Mariana Cordero, also here from Monterrey, and our Director of Institutional Relations and Communication, Ms. Margarita Espinovaros. Allow her to introduce herself.
Thank you very much for the invitation. As Dr. Jorge Valdez said, I am the manager for communications and public relations for the School of Medicine and Health Sciences. So thank you very much.
Gracias. Talita, I think we missed you.
Yes, I'm Talita, and I work with Professor Valeria and Professor Krieger as the International Office Coordinator.
Please, hello, the other members. Would you like to introduce yourselves? It would be an honor.
Hi, I'm Rejane Grotto. I'm a pharmacist and here in Botucatu Medical School at UNESP. and Professor Carlos Magno as a clinician. Okay, thank you for your invitation for this.
Thank you. Gabriela?
Hello, my name is Gabriela Vasquez. I am also representing the Tecnológico de Monterrey. Right now, I am the Regional Dean of the School of Medicine at Guadalajara. It's a pleasure to be here.
Oh, Guadalajara. I've been there.
Yes.
Yeah, wonderful city. Yes.
You should ask her from tequila.
Uh-huh.
Tequila and mariachi.
Uh-huh. Christine?
Doctora Mariana?
Hello, good morning, everyone. I had trouble with my video, but I'm really pleased to be here. I am honored to participate in the Monterrey Tech School of Medicine, and I am in the Professionalist and Wellbeing Program for our medical residents.
Thank you. Professor Julian Santiago?
Hi, how are you?
Fine, welcome.
Sorry for the delay.
We're just introducing ourselves. If you could introduce yourself, please.
Okay. So my name is Julian Franco. I am professor of the Faculty of Medicine of the University of Antioquia. I developed the charge of the head of the International Affairs Relations. So, and I am a Magister of Public Health, and that is it, I don't know. And I am in the representation of the University of Antioquia in this meeting.
Thank you. Gracias. Bienvenidos.
Gracias.
Okay. Christine, Habiba, anyone else missing?
I think we just had someone join us, so just checking.
This is from my office.
Okay.
Yes, Mireya is the coordinator for all the projects for the School of Medicine and Health Sciences.
Wonderful,
Okay.
welcome.
So let's then start the core of this meeting, and I think we have a schedule. So we are going to drive this first meeting based on 3 questions, and I think that your views in different institutions will be valuable, very important. So we shall start then. So the first question here that we were thinking of was regarding the pandemic COVID-19. So in your institutions, in your countries, what was the most critical issue here that you had to face in this first semester? So maybe we can start by institutions. It's easier or it's free. We have 15 minutes for regarding this theme. Professor Aller, would you like to start? So what would be our most critical issue?
I think there is some points. The first one, to prepare our hospital, together with our State Secretary of Health, and you prepare 300 beds of ICU and 700 beds of intermediate care for patients. The patients are referred mostly from different areas of the metropolitan region of São Paulo, and they will receive the worst case, patients in critical ill situations. So most of our patients are intubated in ICU and stay there more or less 14 to 20 days until they are referred to intermediate care. This is the first point. The second point is to prepare a huge structure for research together with our research group, collecting plasma and freezing plasma, and organizing a database to put all clinical data and all necessary for research, future research. So these are very organized by our team of Committee of Research. And there are 2 points, medical education, of course, was the students are receiving classes online. This is a problem because all the rotation of your students was decreased a little bit, mainly in the main hospital, Institute Central Institute. And the residence programs was also mostly affected because all residents was requested to be in charge to take care of patients in ICU, to take care of patients admitted in our main hospital that was transformed in a hospital dedicated to COVID-19. I think it is the principal point, Valeria. But now the number of cases in the metropolitan region of São Paulo is decreasing. So we are preparing to going back to normal activities according to central committee that takes care of COVID-19. You are expecting the next 2 months, more or less, to have the main activities of the institutions, the different institutes, and for instance, ambulatory consults, elective surgeries to be in normal situation, or more or less next to normal. It's for São Paulo, for metropolitan region of São Paulo. Brazil is, you know, is a huge country, very large. So the situation is different in different areas of the country. So but the epidemic started in São Paulo because the flight, because the number of travelers that come here. So we started, the cases started in February, and you have the peak in March, in April. And now you have a plateau and the tendency to decrease in the metropolitan region of São Paulo. The problem is continuous in the University of São Paulo. The students remain, the classes are closed, presential classes are closed, the students remain at home, receiving classes by web conference or by online. So I think this is the principal problem right now. Thank you.
Monterrey, please. Monterrey, would you like to?
Dr. Valdez?
Yeah, well, it's a pleasure. Our most critical issues are related to our mission, our 3 main missions is education, care, education, and research. So the main concern and challenge is the continuity of care, the continuity of education, and continuity of research. The continuity of care, being an academic health center here in Monterrey with 2 hospitals, we start, we want to minimize the disease transmission, the care for the patients, and not just the patient, our own staff, faculty, employees, and obviously the students, but also to maintain our health system. And so we dedicate one of our hospitals entirely to COVID-19 for the treatment of patients. So we expand our capabilities over there for the UCI, the critical care unit. We almost doubled the size of our capability in ICU, but also in beds devoted to COVID. We built some temporary facilities to the detection, to exams. Also, we increase our capability to perform diagnosis and exams on that in the specific hospitals. Although we also maintain some normal activity over there. But we create a system in which we categorize, we call it different levels in order to know if we maintain the normal activities or will close the normal activities. This in relation with the numbers of patients within the city. Monterrey is a city around 5 million, and we have 5 major chemical centers. Ours is one of those. So we also participate with the state government in order to coordinate all the efforts. The other hospital we devoted for normal activities, although we have a lot of strategies to diminish the risk of spreading the disease in this hospital. And also, another objective was we have to refocus our research in trying to participate in different calls from the National Council for Science and Technology to do research on COVID and to do research about the coronavirus. So our research groups, even my group, who is about ophthalmology, we involve ourselves in a topic diagnosis of the disease through conjunctiva and tears, for example. Just to give you an example of things of what all the research group have to refocus their activity. And I would like to ask Dr. Gaby Vasquez, who is here, who is my associate dean in Guadalajara, to talk a little bit on continuity of education. As I mentioned, we have 3 campuses for medical school. So coordinate the teaching and education and the continuity of education was also another part. Gaby, you want to comment on that?
Yeah, sure. I think one of the main challenges during this pandemic has been the continuity of the education. Right now, or at the start of the pandemic, our university was the first one to say we have to go remote, all the classes. So we started with a model that is more like a remote emergency education, not such a formal online courses, because it was something that was coming about upon us as an emergency. So we tried to migrate all of our courses to that model. We had some success. I think it was well received between the students. But right now we have the huge challenge through the university to redesign all of our courses. So we're preparing for coming back at the August 10th. And we're going through a model that is going to be combining online courses with a new redesign, more with more pedagogy. We also having courses that are going to be in a hybrid format. So we're going to be teaching some of the laboratories, some of the simulation on campus, but also with a component online, and also a very few of the courses with a presential component. All of these trying to give the student a vivencial experience, because we have been seeing throughout all our students a very emotional crisis to be isolated at home. So it's something very important for us to give them some of personal experience face-to-face with all the health measures that we can provide. Also, it has been a challenge to return the students to the clinical setting. Right now, we are trying to redesign what are going to be the clerkships. How do we want to send them, like with the PPE? So it has been a challenge right now. And right now we are, I think, the first university in Mexico trying to return the students with a purpose, with safety in our mind. That's our primary mindset. Safety for them and safety for our patients.
Thank you, Abby. One of the other group of students are the postgraduate students of medical education, residents. We have 16 programs and around 300 residents and the equivalent number of faculty. And one of our main concerns, because they have been in the line, actually, so is the well-being of the residents, particularly emotional or mental health. I will ask a brief comment of Dr. Cordero in relation of what because it's a big challenge, the well-being of our residents. If you want to comment briefly.
Yes, thank you very much, Jorge. Actually, our school has been leading an effort from a decade now to implement the well-being program inside of the professionalism and the mentorship program of students. Also in medical residence, as we all know, in the last decade, a lot of international programs have implemented this kind of program in order to consider as a professional competency, the self-care of health professionals themselves. So we have been already working at that these last 5 years with the medical residents, with some pilot programs. And now from last year, we have implemented the program to all first years medical residents and beginning to extend the offer, especially in counseling, psychological counseling, and access to mental health care for all our residents. And since these years, all medical residents had access to our well-being program, in which, as we have also replicated the experience of other international programs that have articulated the health services and the support services that the university already has in place, but bring them closer to the residents, even having the option to go to the main campus, but also having the option to go to an additional building that we have, not in the hospital, for the psychological assistance, in order to support the privacy and confidentiality of their access to the services. But besides that, we have implemented a series of workshops and even a curricular content within the ethical, medical ethics course that every resident takes. So we have the approach not only in extracurricular or co-curricular activities, but also inside the curriculum. So in this specific time of the pandemic, and I will close my comment with this, we have a special organization within the program and the services that we support, even with our psychiatric department, so we can be even closer with the residents and even forming like a kind of a task force of all the support systems and departments that are working with them. We're meeting actually this week in order to be really coordinated, since we're hoping, well, no hoping, but unfortunately we're having this high rise of cases in the city. And also want to mention that we have a series of sessions online in which we are addressing a lot of prevalent issues in resident education, and one of them is mental health, and even have a special workshop online for them in order to give more resources and to be closer to the residents. And also, last, I want to mention the effort of all our faculty that is also going along with the residents in a mentorship role. So we have also to be very aware that our own faculty is going to be on risk of burnout and emotional risk in this following weeks. And we also have in place, and Dr. Valdez can talk about this and emphasize that the Tec de Monterrey as a university has always have a support system for us also as faculty, and a special support system right now for this pandemic.
Thank you, Professor Diaz. I would like to introduce Professor Mauricio from Universidad del Rosario. Would you like to introduce yourself? He just joined us.
Good morning to everyone. Do you listen to me okay that way?
Yes.
Okay, thank you very much. Well, my name is Mauricio Chaparro. I am the head of the Medical Education Department at Medellín University Hospital. I'm also a professor of Universidad del Rosario. Well, I'm here representing both institutions. Mederi is the university hospital of our university. We are composed hospital networks by 2 different hospitals in Bogota, Colombia.
Yes, so July.
Sorry?
Valeria, you're on mute.
You're
muted.
Yes. Would you like Professor Mauricio Chaparro to say in brief words what was the biggest challenge in your institution or area in terms of COVID? What was the impact?
Well, we had a big impact because being the university hospital of our university, we hold most of the students, undergraduate students and postgraduate students in our institution. So with all of this that happens with the COVID, we were obligated to take out undergraduate students. We only keep on academic activities, residents and interns from medical school. The other programs like nursery, physical therapy, language therapy, and occupational therapy, we take them out of the hospital for security, yes? Now, another challenge was the ones that were keep making their academic activities. We need to ensure that they have like all the adequate equipment for visiting patients, seeing patients. Also, we had to restructure the telemedicine, teleorientation activities so these students can get and participate in them. And now we had a big challenge is that for August, we are planning to have back again all our students in the hospital. So we need to rethink the way they come to the hospital, rethink the activities they are participating, rethink the schedule they are coming to the hospital. They can't come on the same time, the same hours as they used to do. So that are the biggest challenges we are facing right now here in our institution.
Thank you very much. Professor Julian from Antioquia, Colombia. Professor Julian Perez.
Sorry, my internet is a little broken. Well, about now?
Yes, we
Yes.
can hear you now.
You can hear me?
Yes, go ahead.
Okay. Well, about this question, I think that the most critical issue or issues is too similar to the other partners, but I guess that I can add that the main problems is that we have heard the scarcity of EPP results. This is very critical. This problem is not a big deal now, but with the descending of the slope of the pandemic, with the curve of the outbreak and the reactivation of the economy, we have to predict the scarcity of EPP and even mechanical ventilators. I repeat, this is not a big deal now, but it's obvious that will be. And the other critical issue is for us, like a public institution, is the possibility that the impact in our economy and the impact in the economy will be reflected in the finances of the UdeA because it's a public institution, so that is it. And the UdeA clinicals and the academic workers and everything about the finances will be impacted. For example, the job stability is now a little diffuse. So, and the last thing, I think that in the educational things, the change we have was brutal and in the all aspects. For example, we had to modify everything and give online the classes, and this is in a steady way. We didn't have time for nothing. This is my idea about the run of the pandemic things. Everything is so fast and we don't have time to think.
from UNESP, please.
Sorry.
Oh, hello, Professor Carlos Magno. Welcome.
I'm Carlos, and I think Rejane already introduced herself. Well, I am a clinician and an epidemiologist with specialty in infectious diseases and infection control. And Rejane is a molecular biologist who is supporting our RT-PCR team, but she's also planning our strategy for security both of our healthcare workers and our students. Here in Brazil, as you may be aware of, we are a huge country. We have a first wave of COVID-19 in the biggest cities, metropolitan areas. But then after that, we have the waves are like, you know, when you throw stones in the water and then several waves appear after that. So we are living a second phase of the pandemics where the pandemics stabilized, had a stabilization in great cities, and it's becoming interiorized in Brazil. And we are from a university, a public university in inner Brazil. Here we have in inner São Paulo state, which is the Brazilian most populous state. And here we have stopped all our courses, our medical students, as well as nursing students and other students, they were all sent home. And of course, our hospital is working with full capacity for COVID-19. That means that other specialties had their daily activities stopped in order for us to respond to COVID. We have made some kind of online training for people. We are very much engaged in the state response to COVID-19 as advisor to our governor. And we are part of a network for both educational activities and also for testing for COVID-19, which is a problem since we are a middle-income country and we have some resource problems. But here in our town, we are doing performing extensive testing. So every symptomatic person is being tested, and we have been able to make diagnoses and isolate people in a timely fashion, so that our mortality is still not as high as in other parts of Brazil. But we are involved in a network for training persons all over, healthcare professionals and students through the web, using Zoom, Skype, and other web-based video conference apps, in order to perform training and to discuss aspects such as source control, infection control, and the assistance to COVID-19 patients, as well as healthcare security, and even the epidemiology, so what the normal person should do in order to prevent the disease. So now I will just pass the word to.
The pandemic have showed us the importance of the country to invest in research applied to existent, because in our city, the diagnostic tests are very used to diagnose early, because the patient has, when he stay in hospital, they already have the diagnosis. And the Brazilian health public system also provides to the fundamental in this context for attendance of these patients with COVID-19. Thank you.
Well, thank you for all your statements. I think we have a very good overview of what's happening in Latin America, and we all face pretty much the same struggles, which is economy, right, organization, infrastructure. So Professor Aller, can you comment? We're going to the second part, which is what kind of measures, some of them were already mentioned, we found to face this challenge. So can you comment on the ventilators? There was a rush for ventilators in the beginning of the pandemics against the big, the big ones like US that bought all the ventilators. Can you comment on the project that we had with the engineering school? I think
yes, I think when the pandemic started and we saw images from Italy, the ICU completely full and the lack of ventilators, I think it's kind of a nightmare that could never could happen for us. But the pandemic showed that the ICUs, mostly ICUs in our country, are not prepared for the number of cases that requires intubation and mechanical ventilation. So in different areas of centers of Brazil, mainly in São Paulo, people started to develop ventilators in a fast way. Looking because you have money to buy ventilators, but the international market wouldn't sold us because the necessity of ventilators in different countries is so high. So we started a project with the School of Engineering, School Polytechnic of FMUSP, to test a new ventilator, very cheaper, less than $500 the cost of this ventilator, so it's so cheaper. And the ventilator now is ready. We are waiting for approval from National Committee of Research, CONEP. Now we have this approval and we are testing. Of course, the pandemic is going down in São Paulo, but maybe for the future it's necessary to have a national ventilator or costs to cover our necessities. Last week, another group from ABC, it's another university, looking for a new project. You are present as a new ventilator. It's different machine, but it's nice machine. Now is more or less ready to be tested. So we are following the same protocol, asking approval from committees to have new ventilators for the future. So I think this pandemic started a new world about our external dependency from medical products. In the start of the pandemic, masks, for instance, or safety equipments for medical team, for professional team, or lack of them. So I think it's now, I think you are more worried about to have some this kind of equipment for our health systems, because the pandemic teach us that you cross very tough times because the patients require the professional team require equipments you don't have to provide them. But I think is going on, and they'll fix everything now. And I suppose in the next few months you'll have new ventilators from built in Brazil with good quality.
Thank you, Professor. Any of the institutions would like to stress the innovations? We heard of from UNESP about the diagnostic tests, and what I think is relevant, we from Latin America, we have to join our forces. I think we have some conditions to develop equipment, tests, research. And if we can join and know what everybody does, I think we have some opportunities here to develop within Latin America. So would you like to comment, anyone?
Yes, Valeria. I think we face, as Brazil and Colombia, the same issue regarding the ventilators. I will briefly show you that we also developed not just the ventilator, we also developed the company to produce the ventilators. We were in a very strange situation because some of the factories that produce ventilators to the United States are in Mexico, and they didn't want to sell ventilators to us. So we have to produce this ventilator, our university, create a company to produce them in association with other big companies. And we just finished all the legal issues regarding for our regulatory agency. So these ventilators is already now being produced in Mexico. So as you mentioned, I think we need to share our knowledge, our creativity, and try to solve the problem that we face as a region that are different from other regions in that sense. You know, also we are doing some research on diagnostic tools and testing, the way we need to test them also, because we don't have enough resources in our country, pretty similar to the other regions of Latin America.
Yes, and what you comment about, you know, driving all the research into COVID, this was a major transformation in all the research in the country. Even like the federal government, the state governments, they are all directed to COVID. And I think everybody here faces the same issue, right? So anyone from other institutions? Julian, would you like to comment on this lack of resources and the attempt to search for, you know, innovations and joints to develop some things in your country?
The innovation of the UdeA was in two things. One of them is the similar to the Dr. Valdez and the Dr. Auler about the development of the mechanical ventilators of the Colombian patent. But the other is that the virology group of the UdeA was the first group of Latin America to identify and typify the whole COVID virus. So that is important because this advance or this development allows to check and determine the possible mutation of the virus, so and permit to identify about the treatments and the possibility to make the cross between the evidence in Europe or in USA and the applicability of that here.
Yes, and I believe that we here have a huge field for research. If we join, we can make, you know, like a common research involving many institutions. I think we have here a very good opportunity to help each other and help the world, right? Here in Brazil, we have also the development of vaccines as well. So we just started, right? Professor Auler, I don't know if you have more information about that. Professor Krieger?
Yes, you have some a partnership between Instituto Butantan. Instituto Butantan is a very traditional, very old institution. They are very skilled in producing vaccines against the flu. And every year, the vaccination program, Brazilian vaccination program against flu, against the other kind of virus like that, Instituto Butantan offered these vaccinations for population. And now there is a partnership with Instituto Butantan and a Chinese company to produce vaccine in large scale. But I don't know exactly what's the level of the production right now. But you know, we know that they are very hurry, very hurry against the time to have the vaccines ready for the next year. And
yes, and
there's another group in UNIFESP, another school of medicine, but there's a group from Oxford, England, UK, and they're a partnership of both, but they are testing volunteers. They receive the vaccines, they're testing volunteers in a large court, international court, to observe the safety of the vaccine and the efficacy of vaccines against coronavirus. But I think
yes.
this is, yeah.
And I also, from many institutions, you mentioned about telemedicine, teleeducation.
Yeah.
I think this is also another platform that we should share experiences.
Exactly. Exactly. I
Yes,
think we walk decades forward to have this instrument. And there's a lot of apps and the instruments to track patients, to make consults and orientation for this time. Because I think the pandemic you have some months in advance. And the patients, of course, are afraid to come to the hospitals. But the normal disease is going on. Right? Patients suffer from diabetes, hypertension, or cancer, so it's necessary to be treated. So the remote instruments, I think, is very helpful to help in this situation that you are living right now.
Valeria.
Yes, Professor?
Let me make a comment about this problem of vaccine and the next future of our organization. I believe this is an area that we need to take in consideration, that we are a network of health centers in different countries of Latin America, and we will suffer in this question of vaccination, because as you know, Brazil is now, as Auler discussed, we are in 2 of these trials. We are right, but we don't know exactly what will be our position and the position of other countries in Latin America when these vaccines are ready. So how we can join our effort to really assure that our population will receive the vaccine. So I believe this is one thing that we need to have in consideration, that is one of the points that we can work in the future as a network of academic health centers in countries that are located in Latin America and are not in the rich countries that are in better position to receive the vaccine first. So this is a problem.
Valeria, you're muted.
Sorry. Thank you for your considerations, Professor. I think it's a huge issue. And I believe that as Latin Americans, we have to stimulate the young generation. So the medical student, the researchers, and I think this is a big field. We can, like in every, this could be a suggestion, and we would enter in the 3rd point, which will be what kind of measures are we prepared, or are we preparing ourselves to face new pandemics? So we have to address mental health of medical students, health professionals. We have to enhance our technology, and I believe that in each institution, you are developing what is relevant or your skills. And I think if we exchange better our human resources, we can share more experiences and expand all our abilities. So this is an invitation for all of you. We have this initial presentation in our newsletter, which was outstanding. Thank you, Habiba and Chris. You helped us to organize this. And this is the proposal here. So this is our first meeting. It's awesome that we met each other, even if it's online. But I think we have to stimulate the young generation to join us and take part in this, all these wonderful projects that you mentioned here. Please, I would like to listen to your comments. And we have like 7 minutes more, and then we'll wrap up.
Already, I have another comment. You talk about innovation, okay? I think it's opportunity for us, for our network, to think about innovation right now, because pandemic obliged us to a lot of new things. For instance, to connect research groups, to create an infrastructure to store dozens of plasma of patients for the future, to organizing a very huge database, because there are thousands of patients that was admitted in your institution. It could be, of course, utilized for other scientists, and telemedicine also. I think it's a lot of innovation together with pandemics that needed to utilize for all situations, including students, because students right now, university recommend the classes could be just in remote, not for presential classes. And I think it is a lot of things that you need to think. I think it's an innovation, right? In this moment that you are living. My comments for the end of this. This is very nice meeting.
Professor
Valeria,
yes? Yes?
I would like to just to make a point about the collaboration issue. I think we have to collaborate more. I think much of the research that's being directed has been a kind of self-contained research, that research that produces papers and citations, but we need public health solutions. We are engaged with that, and we have professionals from geography. We have those modelers here in UNESP. We were the first ones to model the inner area of Brazil. Everyone was looking at São Paulo metropolitan area. We were already modeling the second wave in the inner part, and we could change. We had an impact on the politics of São Paulo State, the policy of São Paulo State for the inner areas. So it's something that we have. I don't think about, if we have the vaccine, we will vaccinate everyone, because Brazil, since the 1970s, has this capacity to vaccinate every small town, every part of a small forest or river, because you have this great structure for vaccinating persons. What we need to have is a vaccine. We need to have the access, both in terms of financial terms and in terms of the proper existence of a good vaccine. So, and about the last thing you said, we have to have some sort of collaboration to preparedness, because other pandemics will come, and we have to improve our capacity of early detection and of early mitigation of other diseases, what seemed to have worked with SARS in 2003. But we know now that we need much more research in control of the spread of diseases. So this is an area that we could collaborate, and we could share our expertise, and that would be very profitable.
From Rosario, would you like to address something about innovation in Rosario?
Yes, thank you very much. Well, we have some examples of innovation we had made here at the country. First of it's that University of Rosario, Universidad del Rosario, was the first one to be authorized by the National Health Institute for processing and making diagnostic PCRs for patients around the country. So nowadays we are more or less processing 1,000 of samples per day and receiving samples from many cities of the country, not just Bogota. On the other hand, we also we won one grant from the Ministry of Science for making research around COVID-19. Our proposal is to make next generation sequencing for 1,000 patients with the virus and explore if there are some associations between the SARS-CoV-2 genome and the clinical outcomes of the patients. So this genome can help us as an early diagnostic tool for predicting how the disease will be behaving in each of the patients. And the third one, and really nice, is that here at Mederi, we create a telemedicine program for patients that are managing their disease at their homes. They are not here with us in the hospital. This program is conducted by some medical students and physical therapy students that volunteer themselves for participating inside the program. And they call more or less 50, 60 patients per day. So they can supervise how their disease is evolving, if they're good, they're not good, if they need to go into a hospital because they have some symptoms that are not have good prognosis. There are like the three main innovation strategies we are developing right now.
Wonderful. I think we have to wrap up in a little bit. Professor Jorge Valdez here suggesting that we organize another web meeting discussing about our research projects. I think it's very welcome. And it's nice because everybody got, enthusiastic about it. And I think we should do it. That's the time for leaving our egos behind and working as a team, right? So thank you very much. Habiba, would you like to finish addressing the newsletter and the perspectives of the academic health centers to help us with this pandemics and this huge problem? Thank you.
Yes.
To share the newsletter to support them. Habiba, thank you very much for putting it in place.
You're very welcome. Thank you for bringing it up. I'm so used to seeing it now. So we have published it, and it's great to have you all on the call so we can formally thank you for your great efforts in contributing to this inaugural issue and sharing your perspectives. We've received so much positive feedback already. Everyone is just impressed and really, really touched by the different perspectives and unique stories. So on that note, I just want to make sure that everyone knows, AAHCI is playing a very crucial role right now in supporting our members during this time and helping our regional offices organize these kind of events, including webinars on topical discussions that are relevant to each region. So I do hope and encourage you all to continue these conversations and really keep the enthusiasm and stamina going so that we can remain a resource, but also support you in any way that we can moving forward. So thank you for taking the time to join us today, and I'll let Christine finish with a word or two before we say goodbye.
Thanks, Habiba. And yeah, I just want to reiterate what Habiba said. And also, we touched a lot on innovations, and we're so impressed by what all of you are doing. And we want you to continue sharing that work with us because we are continuing to put together documents that highlight what academic health centers are doing to respond to COVID-19 and the important role they are playing in their societies and the economy and all of that. So any of that information, please do share with Habiba and I, because we can use that to highlight your institutions and some of the materials we are producing in the upcoming months. And that's all. Please do consider us a resource, and any questions or ideas you have, send them our way, and we will do our best to support you in any way we can.
Can I make a suggestion?
Yes, please.
I believe one thing is important is to have sequence of this discussion today. So if we ask all our members to write a 1 or 2 page, one about the challenge and the other about what we learned in this pandemic period. And then we use the newsletter to disseminate this idea. And if the region asks the members, we have a nice collection of experience that we can learn. So I believe it is important to ask the people to put in right. So disseminate this discussion that we have today.
Yeah, and adding to your comment, Professor Krieger, I also invite on behalf of Clinics. Clinics is our journal from the University Hospital. I talked to our editor, Professor Luis Felipe Pinho Moreira. He's also the vice president of the postgraduate studies here. And he agreed that it would be an interesting paper if we add what we discussed here for an editorial in the journal.
Yeah, okay? But also our colleagues, the headquarters from Washington can coordinate this, not only in our region, the other regions. So learn what happened in the war. And we can learn about what happened in the different regions, not only in Latin America.
Yeah, we can certainly do that and work with our other offices at the same time to disseminate a broader view of, you know, lessons learned, outcomes, and, you know, challenges facing. I think that's a great idea, and we can help coordinate that.
Yeah, okay.
Wonderful. So thank you very much then. I think we are all set. Gracias por la participación.
Thank you.
Thank you, everybody. Take care.
Before you leave, can anyone take a screenshot?
I'll take one.
Eva? Okay, everybody smiles.
Okay, I'll count to 3. 1, 2, 3. Great. All right.
All right. That is sent to us. These are my Japanese jeans. Bye.
Thanks for having me. Bye-bye.
Thank you, everybody.
Thank you.
Bye. Thank you.
Please.
Yes.